If your jaw hurts when you chew, talk, or even kiss, the real problem might be your tongue. Now, you might not think of your tongue as a muscle that can get tight and sore, but it absolutely can. In fact, tongue tension is a common factor in jaw pain, headaches, swallowing difficulties, even breathing problems. So let's go step by step into how you can self-treat these muscles safely and effectively. Your tongue is actually made up of several muscles, both intrinsic muscles that change its shape and extrinsic muscles that help move it around. These include the genioglossus, the big one that sticks the tongue out. The hypoglossus pulls it down. The styloglossus pulls it back. And the palatoglossus helps lift it up. When these muscles become overworked, like from clenching, swallowing patterns, mouth breathing, even stress, they can develop tight spots or trigger points that refer pain into the jaw, teeth, throat, even the head. Trigger points of the tongue muscles can create pain at the base of the tongue, soreness in the throat, jaw tension or tooth pain, and even a feeling of fullness or pressure in the face. Knowing where these referral patterns are helps us explain why your tongue might be part of your temporomandibular joint or headache problems. Now let's go through how you can work on these muscles yourself. I'm going to walk you through 5 different steps. Start by washing your hands thoroughly, sit in a comfortable position, and take a few slow breaths to relax your jaw and tongue. We're going to locate the base of the tongue. Place your thumb under your chin, just behind the point of your jaw. Gently press upward and backwards. You should feel the firm base of your tongue. This is where some of the main tongue muscles attach. Using your thumb under the chin, apply gentle, steady pressure. You might feel tenderness or even a referral of pain into the throat or jaw. That's okay, but keep it comfortable. Hold for about 10 to 15 seconds and then let the pressure go and release. With a clean hand, you can also gently place a finger inside your mouth, behind the jaw, onto the floor of the mouth, underneath the tongue. Press upward towards the base of the tongue and hold for a few seconds. Compress the floor of the mouth between your 2 hands. Cover the whole area you can reach with gentle pressure, holding each spot 10 to 12 seconds. This helps release the genioglossus and surrounding tissue. My Simply TMJ webinars show therapists how to suppress the gag reflex so we can treat the tongue and get way back there. I even show how to treat inside the throat. This is really important for those singers. The link is in the description. Place your right index finger in your mouth and slide it under the left back of your tongue. Gently press towards the midline, the right, as you slide your finger forward. Repeat this 5 to 6 times. It's often very tender at the furthest back part and also near the frenulum or the center, that little webby thing. If you do find a tender spot and it refers, hold that spot until you start to feel some decrease in the symptoms. The first tongue exercise is sticking our tongue out, but we're going to do it into the side of our cheek. So push it into the side of our cheek, keeping our lips closed, and hold it for 10 seconds. Now push it into the other cheek and hold that for 10 seconds. Repeat 10 times and do this several times a day. You will need to build up to this to get your endurance. Finally, our second tongue exercise. We are going to circle your tongue on the outside of your teeth, but the inside of your lips, filling up as far as you can all the way around. Work up to 10 times. Keep your lips closed. Try to get the tip of your tongue all the way up as far as you can above the gums. You don't have to go super fast. Now go in the opposite direction 10 times. Work up to 10 times in each direction as one cycle and then repeat 10 cycles. Do this a few times a day. It's more challenging than you might realize. Start with 5 times each way and do it 3 to 5 times, building up to 10 times each way. These moves help lengthen and relax the tongue muscles after you've released them. After you've done these techniques, take a sip of water and notice how your tongue and jaw feel. Often there's a sense of lightness or easier swallowing. Remember, work gently, and if you notice sharp pain or anything unusual, stop and consult a healthcare professional. To more thoroughly treat the floor of the mouth, watch this video on treating the floor of the mouth.